Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. If you're over 40, if you lift groceries, work a physical job, exercise at the gym, or even strain during a bowel movement, there's one simple daily habit that can dramatically reduce your risk of developing a painful groin hernia, known medically as an inguinal hernia. And here's the surprising part. It doesn't require expensive supplements. It doesn't require surgery, and it takes less than 60 seconds a day. This one habit strengthens the very muscles that hold your organs in place. It protects the weakest area of your abdomen, and it can help prevent many cases of a hernia before it ever starts. Today you'll learn the simple habit that protects your groin and abdominal wall, the science behind why hernias happen, how to do this correctly at home, and how to build it into your daily routine safely. Let's begin. Most people believe hernias happen suddenly, out of nowhere, like a bolt of lightning striking without warning. But the truth is far more unsettling. A groin hernia, medically known as an inguinal hernia, usually begins silently, slowly, and invisibly, long before you ever feel pain or notice a bulge. Right now, as you sit there listening, your abdominal wall is holding back pressure every second of your life. Every cough, every step, every time you stand, lift, laugh, or strain. Pressure pushes outward from inside your body, testing the strength of your muscles like waves crashing against a seawall. And here's the shocking reality. Studies in biomechanics and physical therapy show that the abdominal cavity can generate extremely high pressure during everyday activities, sometimes higher than during intense exercise. Even something as simple as getting out of bed or lifting a bag of groceries can create enough force to weaken the groin if your core muscles are not prepared. This is why millions of people worldwide develop a hernia each year, not because they are careless, not because they are weak, but because the most important protective muscle in the body, the deep core, has been neglected for years. Hidden beneath the visible abdominal muscles lies a powerful structure called the transverse abdominis. Think of it as your body's natural weight belt. It wraps around your torso like a protective shield, stabilizing pressure and holding your internal organs securely in place. When this muscle is strong and active, it acts like reinforced armor. When it becomes weak, stretched, or inactive, the armor cracks. And once that crack forms, pressure begins to push through, slowly, quietly, relentlessly. What makes this so dangerous is that weakness in the core often develops without pain. There is no alarm, no warning light, no signal telling you that your protective wall is failing. You may feel perfectly healthy while damage is quietly building beneath the surface. But here is the empowering truth. Research and rehabilitation science shows that activating the deep core muscles, even for a few minutes a day, can dramatically improve abdominal stability and reduce strain on vulnerable areas of the groin. This simple habit strengthens the body from the inside out, restoring the support system that keeps organs where they belong. It doesn't require a gym membership. It doesn't require expensive equipment. And it doesn't require hours of exercise. It requires awareness, it requires consistency, it requires just one simple daily action: abdominal bracing. Imagine this moment. You are about to lift a heavy object. Your body prepares instinctively. Muscles tighten. Your spine stabilizes. Pressure rises. But if your deep core is weak or inactive, that pressure has nowhere to go. It pushes outward, searching for the weakest point in the abdominal wall. And in many people, that weakest point is the groin. Over time, repeated strain stretches the tissue. Microscopic fibers begin to separate. The opening grows wider, and one day, without warning, tissue pushes through. A bulge appears, pain follows, surgery becomes necessary, but this chain reaction can be interrupted. It can be stopped before it starts. Scientific evidence from sports medicine and physiotherapy shows that training the transverse abdominis improves intra-abdominal pressure control, enhances spinal stability, and reduces mechanical stress on the abdominal wall. In simple terms, a stronger core spreads pressure evenly across your body instead of concentrating it in one dangerous spot. This is the difference between a wall that collapses under pressure and a wall that stands firm during a storm. And the most powerful part of this discovery is how simple the solution truly is. You gently draw your belly inward towards your spine, not forcefully, not dramatically, just a subtle tightening as if preparing for a light tap to the stomach. You hold that tension for 10 seconds, then you relax. That small movement activates the deepest protective muscle in your body. That small movement strengthens the structure that prevents injury. That small movement can change your future. Think about the moments when your body faces the greatest stress. Lifting a suitcase, carrying a child, shoveling soil, standing up from a chair, even coughing during a cold. Each of these actions sends a surge of pressure through your abdomen. Without core stability, that pressure can weaken tissue day after day, year after year. But when your deep core is engaged, your body becomes resilient, stable, protected. Doctors and physical therapists around the world teach this exact technique to patients recovering from abdominal surgery, not because it is trendy, not because it is fashionable, but because it works, because it restores strength where it matters most, because it prevents recurrence of injury. And prevention is always easier than repair. Consider this powerful fact. Hernia repair is one of the most common surgical procedures performed globally. Millions of operations every year, millions of recoveries, millions of lives temporarily disrupted. Yet many of these cases could have been delayed or even prevented by strengthening the body's natural support system before damage occurred. Your body is not fragile. It is adaptable. It responds to the signals you send every day. When you activate your deep core consistently, you send a message to your muscles. Stay strong, stay ready, stay protective. Over time, those muscles become more responsive, more stable, and more capable of handling stress. And this stability doesn't just protect the groin, it supports the spine, it improves posture, it reduces back strain, it enhances balance. It allows your body to move with confidence and control. One simple habit, multiple layers of protection. Picture your abdominal wall as a fortress guarding your vital organs. Every day, pressure knocks against the gates. Without reinforcement, the walls weaken. But with daily activation of the deep core, those walls grow thicker, stronger, and more resilient. This is not about perfection. It is about preparation. It is about giving your body the strength it needs before stress arrives, because stress will come, life will demand effort, and your body must be ready. So start with this one powerful habit today. Engage your core for just a few seconds. Practice it while standing, walking, or sitting. Make it part of your routine, just like brushing your teeth or locking your door before leaving home. Small actions repeated daily create powerful protection over time. Your future strength is built in moments like this, moments when you choose prevention instead of regret. Most people lift, push, or strain without thinking. They brace, hold their breath, and push with every ounce of force, believing that strength alone will get the job done. But what they don't realize is that this very action, the instinct to hold your breath, can be the silent trigger that causes a groin hernia. Every second you strain while holding your breath, pressure inside your abdomen skyrockets. And that pressure is not small. Research in biomechanics shows that during a Valsalva maneuver, which is the medical term for straining while holding your breath, intra-abdominal pressure can rise to levels that surpass even the heaviest weightlifting attempts. In simple terms, the very act of tensing your body incorrectly can tear or weaken the abdominal wall, creating the perfect storm for a hernia to form. Even ordinary daily movements can be dangerous. Lifting a bag of groceries, standing up from a low chair, shoveling snow, or even coughing during a cold can push your body beyond safe internal pressure limits if you are holding your breath, and it happens silently. At first, there is no pain, no bulge, just micro-trauma to the tissues and connective fibers in the abdominal wall. Over weeks and months, these micro-tears accumulate, weakening your body's natural defenses and leaving your groin vulnerable to injury. The shocking truth is that most hernias are preventable, and yet millions of people worldwide unknowingly increase their risk every day simply by exhaling incorrectly or not at all during effort. Physiotherapists and surgeons have known for decades that proper breathing is a cornerstone of core stability. The diaphragm, your body's primary breathing muscle, works in concert with the deep core muscles, including the transverse abdominis, pelvic floor, and oblique muscles, to distribute pressure evenly throughout the abdomen. When you hold your breath, the diaphragm locks, the pressure spikes, and weak points, particularly in the groin, are exposed to dangerous stress. Now imagine the power of reversing this simple mistake. Imagine lifting, pushing, or bending with a coordinated exhale. The pressure inside your abdomen is released gradually. The force is spread evenly across your muscles and connective tissues. Weak areas are protected, not exposed. It is a simple adjustment, but it transforms the body from a vulnerable structure into a resilient, pressure-controlled system. Scientific studies confirm that proper breathing during effort reduces the risk of musculoskeletal injuries, including groin hernias. Hospitals and rehabilitation centers around the world teach patients how to exhale during lifting as part of post-operative care. Why? Because patients who learn to coordinate breath with movement have far lower recurrence rates of hernia after surgery. The lesson is clear. Prevention begins with control, and control begins with breathing. Most people underestimate the cumulative impact of repeated strain. Holding your breath while lifting or pushing just once may not cause a hernia, but do it hundreds of times over months or years, and the tissue in your groin begins to give way. Weak connective fibers stretch, collagen breaks down, and the abdominal wall loses its natural tension. One day, a sudden push or cough can cause tissue to slip through that weakened area, resulting in a painful bulge that surgery alone can fix, but the underlying vulnerability remains. Breathing correctly is not just a protective measure, it is a form of armor. Every exhale coordinates your diaphragm with your core muscles. It creates a natural pressure release system that supports your body during effort. You don't need fancy equipment or expensive gadgets. You don't need hours of training. All it takes is awareness. Inhale calmly, brace your core, and exhale during exertion. This simple adjustment reduces intra-abdominal pressure, protects the groin, and ensures that your muscles, not weak tissue, bear the load. There is also a hidden connection between breath and posture. Studies in kinesiology show that improper breathing patterns are often accompanied by poor spinal alignment. Holding your breath while lifting forces your spine into unnatural positions, further concentrating stress on weak points in the abdominal wall. Exhaling properly aligns the spine, activates stabilizing muscles, and spreads pressure evenly. In other words, breathing is not just oxygen, it is your body's internal safety system. Now think about everyday life. Lifting your child, standing from a low sofa, carrying laundry, even coughing. These are moments when hernias often start. People often assume that only heavy lifting causes hernias. The reality is that any movement that increases intra-abdominal pressure without proper breath control is risky, and most people do it dozens of times a day, completely unaware of the cumulative damage occurring beneath the surface. The power of this knowledge is simple yet profound. You can protect yourself instantly without equipment, without expensive interventions, without hours at the gym. You simply exhale during effort. It is a minute change in habit that can prevent years of pain, discomfort, and costly surgery. Medical experts call it a core principle in hernia prevention. Athletes, weightlifters, and laborers who master this technique report fewer injuries, faster recovery, and greater confidence in daily movement. What makes this even more compelling is the way it works in synergy with core activation. When you exhale during lifting, you not only release dangerous pressure, you also engage your transverse abdominis and pelvic floor muscles. These muscles act like a natural belt, supporting your organs and stabilizing your abdominal wall. The exhale coordinates the diaphragm with the core, creating a unified system that distributes force evenly. Together, core engagement and breath control provide a dual layer of protection that science has repeatedly proven to be effective. The consequences of ignoring this are sobering. Hernias can become trapped or strangulated, requiring emergency surgery. Recovery can take weeks, and many never regain their previous physical confidence. All of this can be avoided by something as simple as breathing correctly during effort. Every breath is a choice. Every exhale is an opportunity to protect your body. Every movement becomes a chance to reinforce your strength rather than expose your vulnerabilities. This is the silent, invisible power that most people overlook. The power of controlling your breath to control your body. Start today. Lift, push, bend, or cough with awareness. Inhale calmly, brace your core, and exhale steadily through exertion. Make it a habit. Over weeks and months, your body adapts. Your core muscles respond, weak areas strengthen, the groin becomes resilient, and the silent threat of a hernia diminishes, sometimes dramatically. Breathing correctly is more than physiology, it is self-preservation. It is one of the few preventive strategies that anyone can apply immediately with no special tools, no costly supplements, and no complex routines. It is free, effective, and backed by decades of research in medicine, physical therapy, and sports science. Your future strength depends on choices you make in these ordinary moments. A simple exhale during effort may seem insignificant, but it can mean the difference between a painful hernia and a healthy, strong body. It can mean the difference between surgery and prevention, between vulnerability and resilience. The body was designed to protect itself, but it needs your guidance. Every breath is a tool. Every lift is a test. Every exhale is your shield. Master this habit, and you are taking control of your health in a way most people never consider until it is too late. Prevention is not dramatic, but it is powerful, and it begins with a single conscious exhale. Most people think that hernias happen because of one sudden lift or one awkward twist, but the real danger is far more subtle. It creeps in slowly, silently, over weeks, months, even years. Every time your body strains, every time pressure builds inside your abdomen, it chips away at the natural support of your groin. And one of the most underestimated causes of this pressure is something almost everyone experiences daily: straining during bowel movements. Chronic constipation is a silent epidemic. Research shows that nearly 20% of adults suffer from regular constipation, and many more strain occasionally without realizing the cumulative damage. Each time you push, hold your breath, and force the stool out, intra-abdominal pressure spikes. That pressure doesn't just stay in one place. It seeks out the weakest point, often the groin, and begins to push against your abdominal wall. Over time, the repeated stress stretches tissues, separates fibers, and sets the stage for a hernia. What most people fail to understand is that prevention starts in the gut. A healthy digestive system is more than just comfort or regularity. It's a frontline defense against serious injury. Studies in gastroenterology and surgery show that patients who maintain regular bowel habits have a significantly lower incidence of hernia formation, especially in the groin. Your body is under constant pressure, and by eliminating straining, you remove one of the most dangerous triggers of weakness in your abdominal wall. Fiber is your secret weapon. Soluble fibers found in oats, apples, and lentils absorb water and form a gel that softens stool, making it easier to pass. Insoluble fibers found in vegetables, whole grains, and beans add bulk and speed transit through the intestines. Together, they create a balance that keeps bowel movement smooth and reduces the need to strain. Clinical trials repeatedly confirm that a fiber-rich diet not only improves digestive health, but also indirectly protects the groin by lowering internal pressure. Hydration is equally critical. Without sufficient water, even the highest fiber diet can't do its job. Stool becomes hard, dry, and difficult to pass, forcing the body to exert dangerous pressure during elimination. Scientific evidence shows that dehydration directly increases the risk of constipation and, by extension, the risk of hernias. Simply drinking enough water daily, 8 glasses or more depending on your body weight and activity level, can dramatically reduce these pressures. But lifestyle factors matter too. Sedentary behavior weakens the abdominal muscles over time and slows intestinal motility. Regular movement, from walking to light resistance training, stimulates digestion, strengthens core muscles, and distributes intra-abdominal pressure safely. Studies in preventive medicine consistently show that physically active adults have fewer instances of hernias and other abdominal wall weaknesses compared to sedentary peers. Even short bouts of daily exercise can make a measurable difference. Another overlooked factor is weight management. Excess abdominal fat constantly increases intra-abdominal pressure, even at rest. Every step, every cough, every movement pushes from the inside out against weakened tissues. Research in obesity medicine indicates that losing even a modest amount of abdominal fat can lower pressure on the abdominal wall, reduce strain during bowel movements, and significantly decrease the risk of hernia formation. Your body isn't failing, you're just asking it to carry more weight than it was designed to support. Adjusting diet, movement, and hydration can relieve that pressure and protect vulnerable areas. Now, consider how these factors intersect. A person with a weak core, poor breathing habits, and chronic constipation is essentially creating a perfect storm for hernia development. The deep core muscles are underprepared, pressure spikes uncontrolled, and abdominal walls are constantly stressed. Conversely, someone who engages the core, breathes correctly, maintains a fiber-rich diet, stays hydrated, and moves regularly creates a multi-layered defense system that significantly reduces the risk. This is where the power of prevention becomes clear. Hernias are not inevitable. They are the result of repeated avoidable stress. By controlling bowel health, maintaining hydration, and managing weight, you reduce one of the most insidious sources of pressure in your abdomen. Every healthy meal, every glass of water, every walk you take contributes to the resilience of your body and protects your groin from unnecessary trauma. It is also important to recognize the compounding nature of neglect. If you ignore constipation, the strain doesn't just disappear. Each push weakens tissue fibers, stretches the fascia, and increases the likelihood of injury in the future. Surgeons have long observed that patients with chronic constipation are more likely to develop complex hernias that require emergency intervention. Prevention, then, is not just easier, it is safer, less painful, and far less costly than treatment. Beyond the groin, maintaining healthy bowel habits has additional systemic benefits. Regular elimination reduces toxin buildup, supports cardiovascular health, and improves energy levels. It keeps the gut microbiome balanced, which in turn impacts immune function and inflammation. When your digestive system is functioning optimally, your entire body performs better, your tissues recover faster, and your core muscles can handle stress more effectively. Even small adjustments can yield dramatic results. Adding just 1 or 2 servings of fiber-rich foods each day, increasing water intake, and incorporating a few minutes of light physical activity can shift the internal pressure dynamics in your abdomen. Over weeks and months, these changes accumulate, strengthening your body's natural defenses and lowering the risk of groin hernias. Think about the difference between a proactive approach and a reactive one. A proactive individual strengthens the core, breathes properly, and supports healthy bowel movements. A reactive individual waits until the pain appears, until the bulge is noticeable, until surgery becomes the only solution. The first approach is empowering, the second is avoidable, and the choice is entirely within your control. Medical literature is clear. Chronic straining is a major risk factor for hernia development. Prevention strategies that target digestive health, hydration, and weight management reduce recurrence rates and improve long-term outcomes. Yet most people never hear this advice until it's too late. And that's the shocking part. Simple lifestyle choices backed by scientific evidence can prevent a condition that is otherwise treated surgically in millions of people every year. Your body is designed to protect itself. Every day, it distributes pressure, supports organs, and adapts to stress. But it needs the right conditions to thrive. Healthy bowel habits, adequate hydration, and a balanced diet provide those conditions. They remove one of the most insidious sources of abdominal strain, allowing your natural support systems, muscles, fascia, and connective tissue to do their job. The message is simple. Prevention is not complicated. It is deliberate. It is conscious. It is a series of small, consistent choices that dramatically alter your body's resilience. By respecting the signals of your digestive system, drinking enough water, eating fiber-rich foods, staying active, and managing weight, you create a strong, pressure-controlled environment that shields the groin from harm. Hernias may appear sudden, but they are years in the making. You cannot stop every force in life, but you can reduce avoidable stress on your body. You can protect your core. You can prevent the silent damage that leads to painful, disruptive, and sometimes dangerous hernias. Every meal you eat, every sip of water, every walk, every conscious effort to avoid straining is a choice for prevention. It is a choice to respect your body, to strengthen it, and to defend it against one of the most common yet preventable injuries in the world. Prevention is within your reach. It is not dramatic, it is not expensive, but it is powerful. By supporting your digestive health, you are supporting your core, protecting your groin, and taking control of your body's future. The choices you make every day are not trivial. They are the shield that guards your strength, your mobility, and your quality of life.